environment is seen, good morning. We are dealing with the lifespan development of the individuals, and we were dealing with also the heredity versus environmental relationships and how the behavior genetics affects the individuals. We know that there are many studies which show that the similarity in environment can lead to development, similar development. And also there were many adoption studies which made us understand the similarities of adopted children with biological parents versus the adopted parents. And we know that there is some relation with nurturing as well as the nature. Now, besides the nature versus nurture controversy and the behavior genetics, we've also dealt with the shared and the non-shared environmental experiences of the children and the epigenetic view that the concept of development explains the role of genes and the role of the environment, both are equally important. That is the genetical view as well as the hereditary, which deals with the changes in the heredity as well as the environmental that affects the psychological development of an individual were dealt in detail. Today, we'll be dealing with the different stages of development, starting from the primary stages, that is the prenatal and infancy stages, and we'll also deal with some of the childhood stages. We know that the reproductive system of the female, it is in the reproductive system of the female that the life begins. After conception, the fetus develops, and we see that the prenatal development occurs roughly for about 38 weeks or approximately 9 months. We can talk about these changes, the prenatal stages, as consisting of 3 phases. And generally, the prenatal period shows certain changes which are well established in the starting stages. And we see that the hereditary environment or the endowment is fixed at this stage itself. We know that the favorable conditions in the mother's body can foster the development of hereditary potential, whereas unfavorable conditions can lead to what we call arrest their development. The sex is also fixed at this time. We know that there is proportionally greater growth and development taking place during the prenatal period than any other period or any other period during the lifetime of an individual. We know that the individual grows from a microscopically small cell to an infant, which measures roughly about 3 to 3.5 kgs during these stages. So development is very rapid during this period. The prenatal time is also known as the antenatal time, that is before the natal, that is before being born. And this time consists of many hazards, both physical as well as psychological. Let us start the stages of the prenatal period. Initially, the period of zygote starts from the conception at the end of the 2nd week. The egg or ovum slowly travels to the fallopian tube. And if the sperms are at that location, it may unite with the ovum in a process called as fertilization. Only one sperm can enter the egg's ovum or egg's outer membrane. And this moment a sperm penetrates the egg, the conception starts, and we have a new and separate cell which is formed with the unification of the sperm and egg, known as the zygote. If a single zygote divides into 2 or more, it divides into to form 2 embryos, this is known as the monozygotic or identical twins, and both of them develop. If, however, 2 separate ova are released and they are fertilized by 2 separate sperms, they form 2 different zygotes, and when they are implanted in the uterine, this will lead to the formation of dizygotic or non-identical or fraternal twins. The fertilized zygote or zygotes then start to divide. The first division that produces, actually makes the zygote divide into 2 takes place after 24 to 36 hours after fertilization. The cells then start dividing and form a ball of cells known as morula. And we see that there is a cavity developing in morula after some time, and then the cell, the zygote is known as the blastocyst. The cells in the course of dividing travel down the fallopian tube and enter the womb, where the blastocyst then implants itself into the walls of the uterus. This generally happens 5 to 6 days after fertilization. During the next 5 to 7 days, the blastocyst establishes a primitive placenta and develops circulation, and thus ensuring the supply of nutrients as well as oxygen, which is essential for the continued development of the fetus. If it is the most possible hazard during this period is sometimes if the nutrients are not there, or if there are not enough hormones to help in the development of the placenta, then it is possible that the fetus may die. The period of embryo is from the 3rd to 8th week. We here see that the fertilized egg will start growing into the mother's uterus, and the amniotic sac and the placenta and the umbilical cord are formed. The amniotic fluid is a watery liquid in which the developing embryo floats, and this acts as a protective buffer. The tendrils that attach the embryo to the mother's uterine wall is like a fleshy disc-like structures known as placenta. And this placenta is attached to the abdomen by the umbilical cord, which is actually tries to carry oxygen and nutrients to the growing baby and also removes the waste material like carbon dioxide and waste. We see that during the embryonic period, the inner mass of the new organism differentiates into three layers: the ectoderm, the outer layer, the mesoderm, the middle layer, and the endoderm, the inner layer. The ectoderm is the outer layer which develops into skin, hair, nails, etc. Whereas the mesoderm develops muscles, skeleton, as well as the circulatory and excretory organs. The endoderm or the inner layer is the layer from which the eustachian tube, the gastrointestinal canal, the lungs, pancreas, salivary glands, and such develop. We have to see that initially that the heart also starts functioning from around third week, and it is then only two-chambered. The blood is circulated throughout the fetus. This enables the removal of the waste and the acquisition of the nutrients. This is considered the most crucial developmental stage, and the potential danger to this stage is that the embryo does not get enough protection or nourishment. There may be miscarriage or malformation. The period of fetus is where the prenatal development starts finally is at the end of the 8 weeks. We see that both the internal and external features start to grow. This period is marked by continuous development and differentiation of structures that are emerging, which have started emerging during the embryonic period. We see that very few new structures appear. We see that also that the origins of the motor, sensory, as well as the learning behaviors start. This period is safer than the earlier period, but is not free completely from hazards. At the end of the 4th month, mothers feel the fetus movement. At around 5th month, we can see the fetus showing reflexes such as sticking, swallowing, hiccuping, etc. Also, at the end of 22 weeks, a fetus may weigh over a little of 1 pound, that is nearly about 0.454 kgs, and about 1 foot in length. The fetus can also show certain sensitivity to light, and this can be stimulated or irritated. Although there are a few cases of fetus being born at this stage, but there is a limited chances of survival. Between the 4th and 6th months, most of the organs that are found during the first 3 months begin to function. If born at this time, there is a chance survival. This period where there is a chance to survive is known as a viable stage, and this occurs somewhere between 22 to 26 weeks. If born at this time, there's some chance, but during the 7th month, the fetus is only about 3 pounds. And at the end of the 7th month, a few more pounds are gained before reaching the average of around 7.5 pounds or roughly about 3.175 kgs. We find that the brain starts developing at an increasingly fast rate. And by this stage, the fetus is able to respond to sounds outside the womb and develops a preference for the tone and rhythm of the mother's voice. In the 8th month, the fetus has scope for large movements. And a layer of fat is added that will assist the fetus in temperature regulation. The lungs, however, are still immature. And if the infant is born at this stage, the infant may actually require some help in breathing. And in the 9th month, that the lungs are mature enough to regulate breathing without any assistance. In the last month of the gestation, the baby continues to grow at a rate of roughly around 0.2 to 0.4 kgs per week. The lungs are maturing and the baby or the infant starts preparing for the first breath. The hazards in the prenatal development is, we see that there may be certain hazardous agents in the environment which may cause abnormalities in the development of the fetus. We call such hazardous elements or the hazardous agents as teratogens. Teras meaning marvel or some sort of monstrosity. So a teratogen generally exhibits its power during critical periods in the development of the fetus. And we see each teratogen has certain particular effect on the growth of the fetus. For example, so a teratogen like, German measles may also cause, also known as the rubella virus, it may cause some sort of deafness. Similarly, substances like quinine and streptomycin may also cause deafness. Thalidomide consumption results in the malformation of the limbs. Also, we see certain teratogens which affect the heart, eyes, and brain of the developing fetus. We know sometimes that the fetal or the what we call the mother paternal or the maternal genotypes may try to counteract the teratogen's effects. But then generally the effect is in spite of the counteraction, the most of the times we see the teratogens affecting the growth of the fetus. The longer a fetus is exposed to a particular teratogen, the greater is the intensity of the effect. The major teratogens that one can see are the drugs, chemicals, and metals, which may actually affect the growth of the fetus. If the amount of the substance and the developmental stages of the baby, as well as the period of time over which the mother is exposed to the chemical, all these have a role in what we call the effect of the particular chemical or drug on the development. We see sometimes that the mothers who are addicted to heroin, morphine, or methadone give birth to low-weight babies, and also to infants who have symptoms, who show symptoms of withdrawal, including tremors, convulsions, etc. Also, this will result in so many growth-related problems like low birth weight, premature birth, and withdrawal, and problems in conceiving. And there are also dire consequences for nicotine consumption persons. And we see that the hazards are faced while the fetus is in the stomach, fetus is in uterus. That is, the nicotine increases the risk of spontaneous abortions and bleeding during pregnancy. And there is a premature rupture of the amniotic sac, and fetal deaths also occur. The father's smoking may also transmit to the mother in the form of passive smoking, and there is a risk of cancer to the offspring. And we see the mothers who smoke give birth to babies who are about lighter and smaller in all dimensions, for example, in their length and head circumferences. Caffeine also has a problem on the growth of the child and may also result in low birth weight infants. Alcohol leads to a condition known as fetal alcohol syndrome, or FAD. This approximately affects 1 in 750 births. This leads to malformation of the organs as well as mental retardation. Thus, heavy drinkers may place their fetus in danger. Therefore, they must abstain from drinking. Mothers also have 1 or more drinks daily were 3 times more likely to miscarry than the mothers who do not consume. Possible complications include phenomena like growth retardation, malformation of the face, brain damage, hyperactivity, learning disabilities, and heart defects. Hence, pregnant women are typically advised to avoid alcohol. Marijuana, again a drug, also causes difficulty in conceiving as well as the infant. It leads to the premature birth as well as low birth weight and high-pitched crying. Lysergic acid diethylamide, also known as LSD or acid, also is a psychedelic drug which leads to chromosomal breakage and therefore abnormalities in the infant. Diethylstilbestrol, DES, causes premature birth, low birth weight, and the female children may develop the cancer of the cervix. Thalidomide is said to result in the deformation of the child's face, limbs, fingers, and toes, and also the malformation of the heart and digestive and genitourinary tracts, and to the malformation of the limbs. We have got quinine, which is used to treat traditionally malaria, which was also been associated with deafness in the children. Reserpine drug can lead to respiratory problems. Tetracycline antibiotic is to be avoided during pregnancy as it can also produce changes in the skeletal growth. Aspirin may also lead to blood disorders, And anticonvulsant medications which are used to remedy seizures and which can rise to the cleft lip and palate and may also result in failure of blood coagulation. Anesthetics, that is, which are used to for short-term depression of the infant's responsiveness, along with the resulting in impaired attention and motor abilities. And also the lead exposure to lead, methyl mercury also are known to cause miscarriage, anemia, and methyl mercury is said to lead to cerebral palsy. Radiation is another type of teratogen, and increased exposure to radiation may lead to microcephaly or small head and stunted growth and leukemia and cancer and other cataract diseases. Now, the maternal factors are many, and if the physical condition of the mother, the disease, the age, the diet, as well as the blood components and prolonged stress are some of the factors of the mother which may actually also affect the prenatal child. The physical conditions, that is, women who weigh less in body weight also have, they face the risk of pregnancy complications and delivery complications if they are underweight. The age of the mother is another factor which may actually affect the fetal growth development. The diet of the mother, as well as the diet which may consist of low minerals or vitamins, may also have an influence on the child growth, and child may also suffer from certain weaknesses. Now, insufficient iron leads to the anemia of the infant, and low intake of calcium results in poor bone formation. And if there is an insufficient amount of protein, this also can have an effect on the baby. The baby may be small than average and may suffer from mental retardation, with almost 20% fewer brain cells. The RH factor is another factor or protein in the blood which can result in dangerous situation in fetus. When blood containing the RH positive factor is introduced into the blood without the RH factor, that is negative factor, then the antibodies can form and these can combat the RH factor produced. The RH negative mother and an RH positive father may result in RH positive child. Any small rupture in the capillaries of the placenta will release the RH factors into the mother's bloodstream, causing her body to produce the antibodies needed to fight it. Now the antibodies in the mother's blood, who was originally not having the protein, will then cross the placenta and into the fetal bloodstream and attack its RH positive red blood cells, and thus depriving the fetus of the oxygen. This will result in the miscarriage of the fetus. Then also there are a number of diseases and disorders which, if occurring in pregnancy, may result in what we call problematic baby's development. Since the placenta cannot filter these extremely small disease carriers such as viruses, children may be born with malaria, measles, chickenpox, mumps, syphilis, and other venereal diseases which also can be transmitted from the mother. If the mother contacts the disease rubella, as I was saying earlier, it will result in the congenital abnormalities like heart disease, cataract, deafness, or mental retardation. HIV and AIDS, if the vast majority of children who they are actually getting these diseases are contracting it through the mother during early birth stages. Toxemia is a frightening condition involving high blood pressure and proteins in the urine that are potentially fatal for the mother as well as the child. Mothers with toxemia frequently give birth to premature babies. Anoxia is a condition in which the fetus does not get enough oxygen, and this will help in the slow growth development of the brain. Anoxia can also result in certain forms of epilepsy, mental deficiency, cerebral palsy, and behavioral disorders. Mumps is characterized by swelling and pain around the neck. And if this virus affects the mother during the pregnancy, it will result in fever and headache and leads to malformation of some kind in the baby. Hypertension or high blood pressure also gives rise to fetal abnormalities and miscarriage and death. Diabetes or blood sugar abnormalities lead to eclampsia, which is high blood pressure during pregnancy, and this actually refers to a severe progression of preeclampsia that is accompanied by seizures in the mother. Now, diabetes is also associated with hypertension, and this may also result in the stillbirth or death of the fetus. Syphilis is a sexually transmitted disease which creates miscarriage and where the child may be born, or if at all the child is born, it may be born blind or mentally retarded. Also, the emotional states of the mother, besides the physical condition, the teratogens, and also the diseases, we find that the emotional states of the mother can have a effect on the child. We find that there are any feeding or sleep problems, or if stress is there, we know all the negative experiences, all these may actually result in the undergrowth of the fetus or sometimes in certain abnormalities. The birth hazards, that is, hemorrhaging during the birth or failure to breathe early in the fetus may lead to injury in the head. And these any injury during delivery also may lead to damage of brain vessels. We see that the cells die due to lack of oxygen. The child may die or experience mental retardation or may have difficulty in speaking if there are any hazards faced during the birth. Due to the damage to the cells of the brainstem, the motor defects are also seen. We can say ultimately that the prenatal development can be divided into three periods, such as zygote, embryo, and fetus. And now these are the continuous phases of development, and the organism is protected in various ways. And the care is taken by the nature to see that the embryo persists well in the mother's uterus. But sometimes during the prenatal development, several problems are caused either due to the physical or the psychological aspects or the health aspects of the mother. So this is the stage where the mother has to take the utmost care, as this results in the well growth and development of the child during the later stages. The next stage is the development. In this development is the infancy stage. The word infant means in Latin, unable to speak. Now this stage is approximately starts from the period of birth to 2 years of the age, when the language starts to flourish. We know the infancy is characterized by many firsts. There's a first smile, first successful grasp of the infant, first evidence of separation from the mother leading to separation anxiety, first word, first step, and first sentence. We know this stage is a dynamic stage, ever changing, and here we see an orderly, a predictable sequence of events taking place in the body, and both the neurological development takes place, nerve development takes place, and also the physical growth takes place. The period of infancy plays a major role in the later development. It is during this time that the baby explores the world through its sensory and motor skills. During the first 2 weeks after the birth, the infant is tries to adjust to its environment, and we see that conditions are different from the inside of the mother's womb. From the second week onwards, the baby's growth starts taking place very rapidly, and there are many developmental stages during this infancy. And we know that the period of infancy, that is adjustment period to the new environment, the time is for the radical adjustment. And we see that the human lifespan legally begins after the stage of the birth. The infancy is we see a plateau in development. During this period of prenatal development, there is a rapid growth and development. But during the growth suddenly comes to a stop with birth due to the necessity for making adjustment to the postnatal environment. So once this adjustment is made, then the infants resume their growth and development. Infancy thus finds a plateau, or there is some sort of a stopgap in the development. Also, we see the infancy is a preview for later development. It is a period of future prediction. We can say by seeing certain activities that we can predict how it can develop. Infancy is also a hazardous period, because physically it's very hazardous, because there are difficulties in making necessary radical adjustment to the new, totally different environmental conditions. There is the coldness, the hot, and how actually they're able to overcome the obstacles. So also this is the time when attitudes of significant people towards the infant are crystallized and changed radically. And we see that depending on the conditions on birth and how the parents adjust, the infant is also able to adjust to the environment. We see that the physical development of the infant, we see that the infant's head is large, while other parts of the body are smaller. During the next 2 weeks after the birth, the babies are called as neonates or newly born. We find that there's a rapid growth in infants after from the few weeks. The infants are generally wrinkled, spotty, and have a reddish skin and a large head. But then they start growing later after a few weeks to the 2 years of their lives. By the age of 5 months, the average infant's birth weight is somewhere around 6.75 kgs. And by the age of 1 year, the baby's weight will triple to something like 7.9 or roughly around 8 kgs. And generally, they then start growing about a foot and about 30 inches tall. By the end of the second year, the average baby's weight is 4 times as much as that of the birth, and the height would be at least 3 feet. This is after second year. We find that the sensory and the perceptual development of the infant starts. We see that there is a visual acuity which leads to clarity of vision during the baby's first year. The infant's colors receptors start working right from the time when they are 2 months of age. And also we see that they cannot perceive depth and hence they avoid heights. This is actually known as this is because they have the sensory threshold somewhat higher than that of adults. They can hear sounds, but gradually this sensory threshold comes to somewhat less, it becomes less. They are able to discriminate between sweet and sour tastes. And we also see that the taste is developed since at the birth. And we see that different smells can be observed after different smells can be actually differentiated in the babies right from within 2 hours of birth. The neonates, the vision develops somewhat more slowly than that of the other senses. Responses to light and darkness are functional. Within 2 days of birth, and they can follow, and within 10 days roughly, they can follow the movements and their eyes with their eyes, and they can focus their eyes to a distance of 8 to 10 inches. By 6 months of age, the infants are able to discriminate between objects like circles, triangles, and the face of parents and strangers. They also are able to distinguish by 2 months the familiar and unfamiliar faces. The depth perception occurs only when they are able to understand the difference between the depth is found only after a particular age. For example, they have to get cues about the depth and distance which are available in the infant by 5 months of the age. By 5 months of age, the babies can coordinate their two eyes and depth perception develops then, by which they are able to understand the depth. But stereoscopic vision, that is how to combine both the left and right eye vision and make it as a single different image, that starts also gives rise to the depth perception. There is an experiment by Gibson and Walk which actually talks about the visual cliff. So they have placed a glass, and when there is a perception of depth, even when their mothers called, the children were not able to move from one side to another. This shows that the babies were fearful of heights and avoid them. The motor development also we see in the babies. The babies try to support their bodies against gravity and manipulate objects. These sort of motor skills develop by 6 weeks of age. By 6 weeks of age, we see that the babies are able to hold their head straight. By 2 months, the babies can roll from side to side. And by 3 months of the age, the babies are able to grasp an object. By 7 months, the infant can sit alone and begin to crawl. And by about 1 year of the age, the baby starts walking independently. So all these development are in sequential order. Coming to the other changes, we know that the infant can stand by the age of 11 months and they start walking alone without any support by 12 months. And by 17 months, the infant can walk up steps with little difficulty or with little support. By 18 months, that is 1.5 years, the infant is able to manipulate objects and feet while walking, such as kicking a ball. So motor skills are linked with developmental stages, and these also are related to perception and cognition. the acquisition of new motor skills actually produce infants with new sort of information. So that is, the development of eye and hand control provides infants with operation about events and the location of objects and persons, and also surfaces. The also takes place based on all these developments in the physical and the motor abilities. We know by 1 month, the baby uses reflexes and reflexive behaviors to different environmental conditions and is able to recognize and learn basic associations. By 2 months, the infant is able to anticipate, that is, by seeing its mother, it is able to stop crying and is also able to show in animate behavior from humans and exhibits organized and selective looking. By 3 months, the infant starts reacting to new objects, makes mutual eye contact, enjoys a face or objects of interest. Now it looks longer at an object and attends, and its attention is somewhat more investigative. By 4 months, the baby repeats actions that are pleasurable and satisfying. And it is also reacts differently from unusual objects and favorably, and it tries to reach out those objects which are interesting to it or which are known to it. By 5 months, the infant visually starts following the moving objects and focuses attention on moving objects as well as moving persons. By 6 months, the baby starts learning the behavior of a known person, reacts to change events. By 6 months, the infants have the ability to perceive depth and thus avoid falling. By 7th month, the baby starts exploring by manipulation, drops objects from heights, and understands the notion of physical support and focuses more attention while playing. By 8th month, the baby starts displaying fundamental problem-solving abilities. It attends to play, and also everything in this month is by way of exploring. By 9 months, the infant starts to remember without cues, and it solves problems, is aware of the cause and effect relationship. It understands the outcomes as are due to its own actions and perceives distant objects and shows goal-oriented attention. By 10th month, the baby starts investigating different parts of toys, repeats play sequences, and finds out hidden objects. By 11th month, the infant accomplishes goals using different toys and is more easily entertained. By 1 year, the baby is able to comprehend objects, uses imitative learning, recognizes self in mirror, and follows others' glances. By 15 months, the infant tries trial and error learning, understands the functional quality of objects, uses dolls in plays, and shows clear evidence of social referencing. By 18th month, the baby experiments with objects, recalls better, and uses language as a direct attention. By 21 months, the infant to some degree understands past, present, and future. By 2 years, the baby is able to think symbolically and uses language to a certain extent to direct attention and regulate behavior. It is also able to reproduce behavior and observation and tries to solve small problems and engages in fantasy plays and recognizes the different roles of the family members. The cognitive development of infants, according to Piaget, says it starts from simple reflex in the inborn babies where they try to grasp or stroke objects, and from this they start developing, and the fundamental aspects seen in the infants gradually start growing into more manipulative things. The next stage, from 1 to 4 months, we see that there are primary circular reactions in the child where the single coordinate actions are actually integrated into somewhat an integrated activity. And we see that there is a cognitive schemes being developed in the child that is due a process known as circular movements. Primary circular reactions are something where there is a repetition of an action which makes it enjoyable or interesting to the child. And for the pleasure of doing this, the child will try to focus or repeat certain actions. Initially, they start with the infant's own body, and we see that it is a chance event. The infant may start trying to put its finger in the mouth or thumb in the mouth, and it finds it pleasurable, and it continues to repeat. the same action, and this is known as a primary circular reaction. This is actually is due to the pleasure that the action gives to the infant. The secondary circular reactions are also repetitions of certain acts of enjoyable events, but then these actions are carried out because this is in relation to the environment, and these secondary circular reactions are actions relating to the world outside, and also they may are pleasurable to the child. For example, a child may go on rattling a toy because it produces a sound. The coordination of the secondary circular reactions is seen from 8 months to 12 months, where the infants employ goal-related behavior. That is, they try to push one toy with another toy to actually reach out to a particular other toy. That is, they're trying to conduct certain acts which will result in solving a problem. So we find here the coordination of the secondary circular reactions. The tertiary circular reactions take place from 12 months to 18 months, where there is a deliberate, exploratory manner. The infants try getting into different positions, and they try to begin and repeat things so as to get some output. For example, they may drop things in different positions to get different sounds. After we find 18 months to 2 years, the invention of new means through mental combinations, where the infants, they try to copy the behavior of models. We also see here the infants are engaged in pretend play, that is like feeding a doll or teaching students, etc. The language development is another aspect that is to be considered in the growth of the infants. We find that the infants actually start with the sounds like crying. That typically it is the first sound produced. After the basic crying or the pattern with intermittent silence, we find also crying where the baby is angry. It tries to force air through the vocal cords. Now this will result in sudden loud moaning and breath holding. This is actually because each crying has a different meaning. Sometimes they may be hungry or thirsty, or sometimes they may urinate and they want the diapers to be removed. So the crying means several things. At around 1 to 2 months, babies start cooing, which is a form of gurgling sound produced at the back of the throat. This is the next sound which is produced in response to a person interacting with the infant. Babbling is the sound which is seen in the middle of first year, where the infants start babbling or producing sounds by repeating consonant or vowel sounds like mama, baba, etc. Now, gestures are shown around 8 to 12 months of age, where the infants start waving their hands when they see somebody in order to be picked up. Also smiling during interaction with others around 6th or 8th week, or laughing when they are 4 months old. This will help the infants to communicate and build their bond with the parents or others. The first word is generally uttered around the age of 13 months, and by 1.5 years, they start building their vocabulary. Here we have got the Noam Chomsky, a linguist at MIT, who talks about language as a biologically based unique accomplishment. He believes that we are all born with a pre-wired structure known as language acquisition device, known as LAD. Now, a biologically based innate system that enables the child to process the language input, to construct rules and to understand and to generate appropriate grammatical speech. Now, this is not actually an organ, but merely a hypothetical mechanism, and it should be universally applicable because we see in different countries and different language speaking parents that this LAD is a common phenomenon and it is a universal grammar. And the nativist perspective talks about the deliberate training of parents is unnecessary for language training as there's LAD. The behaviorist theory says that the parents actually should train the children. But the LAD says that because all the children all over the world go through the similar stages in language acquisition, we know that there is babbling in all cultures, and also the deaf children are also able to babble, that there is a somewhat this LAD, which is dependent on the changes in the brain and maturation, and which is common to all the language systems. And this actually is a function of the brain, and it is the sensitive period of language development. These children have this ability of developing this language irrespective of training. So all the language human beings are prepared for acquiring language in a special way, says Noam Chomsky. We can also look at the social development of infants. We know that the infants start interacting by looking at their parents and vocalizing gradually. Initially, they start smiling, holding, laughing, but then they start babbling, and also they show more interest in their peers or than in inanimate objects, and they show preferences to others. And in the first 6 months of life, they touch and look at another and respond to each other. And if one baby cries, actually, the other baby also starts crying. There are two babies. And between 6 to 12 months, the infants influence others by vocalizing and by looking and by waving at the babies. And babies aged to 9 to 12 months usually present and accept toys. And at the age of 14 months, they engage in social games and imitate each other. So we find at different stages of development, the infants also start showing social development and their social relations. And in this manner, the infants build love and friendship relationships with family members and a few significant others. So at the end, we can say that the newborn infant is a helpless creature with limited means of communication and few skills, but it is the first stage of development after birth, which continues until the second year of life. And during this period, the relationships with others start, and they learn a lot about the physical world and undergo a vocabulary explosion. The language development leaps ahead here, and we find during this stage that there is both physical, motor, cognitive, and social domains development occurs, and the changes in one domain influence the changing or the development in others. That is, association is seen between the infant's motor and cognitive development. So the rate and amount of growth during infancy suggests that care must be entrusted to these infants so that development can be fostered and that the infant achieves the milestone and proceeds to the next stage of the childhood, that is known as the childhood stage. When we consider the childhood stage, we see that there is certain stages like both the early childhood and the late childhood. We know that the early childhood is from 2 years age to 6 years age. Here, we see from they pick up lots of skills and he becomes very imaginative. Imagination and initiative start developing to the child, and they start interacting with outside world, and they explore and they experiment and ask questions. And during the middle and late childhood, where it extends from 6 years until the child becomes sexually mature up to 11 age, we see that the stage is somewhat troublesome or quarrelsome age, where they start forming the gang age, also known as the age of conformity. Gang loyalty and prejudices are seen, and also here thinking is more flexible and related to objects, and they classify objects, but still they're not good at abstract thinking. There are certain things known as developmental tasks. Havinghurst in 1972 says the developmental task arises at a certain period in life of an individual, and successful achievement leads to happiness and success with later tasks, and the failure leads to unhappiness in the individual and disapproval by society and difficulty with later tasks. So according to the Havinghurst, he divides these developmental stages according to the developmental tasks that one has to perform during the particular period. And these stages are infancy and early childhood, which is from birth to till 6, and the middle childhood from 6 to 12, and adolescence 13 to 18, and early adulthood 19 to 30, middle age 30 to 60, and later maturity from 68 onwards. We know that it is the childhood stages, that is from age to 0 to 6, the child actually learns to walk, develop certain communication skills and motor abilities, and it also starts crawling. It start taking solid food, learns to talk and connect with others. It learns to control the elimination of body waste. That is, control is exhibited on the excretory mechanism, as well as learning sex differences and sexual modesty, and they become ready to read. From the ages 6 to 12, we see that they learn all the physicals that are relevant or necessary for ordinary games. They learn to get along with others, and they start building wholesome attitudes and learn adult appropriate masculine or feminine social roles, develop concepts that are necessary for everyday living, and develop conscience, morality, and a scale of values. They also achieve personal independence to a certain extent. But it is during the late childhood, that is from 12 to 18, that they achieve more mature relations with age and masculine or feminine social roles, and they use their physique and body effectively, achieve emotional independence, and prepare for married and family life, and acquire a set of values and ethical system as a guide for their own behavior in society. We know that the physical development of the child is very important because this also will lead to cognitive and other social developments. We know that there are certain principles of physical growth. That is, the growth is cephalocaudal. That is, it starts from head and leads to other parts of the body. And also we see that the head and face movements in the first 2 months after birth are more, and they're able to lift themselves by using their arms in the next few months. So infants start gaining control of their body, and they start crawling, standing, and walking by about 6 to 12 months age. This coordination of arms precedes the coordination of the legs. The principle of proximal caudal development indicates that the development proceeds from the center of the body to the outsides. Now, this is the direction of development. The spinal cord develops before the outer parts of the body. The child's arms develop before the hands. Hands and feet develop before the fingers and toes. Now, these finger and toe muscles develop last in the physical development. Also, there is a principle of hierarchical integration where simple skills are developed first, and then the simple skills are integrated into more complex ones. The principles of independence of system talks about that there are different growth taking place in different systems and at different times, and the body size, nervous system, sexual characteristics are all developed based on each other, and they're independent of each other. So each system develops independently of the other system. For example, the nervous system develops independently of sexual characteristics, etc. We know that the physical growth also does not happen at one time, and it is not as a whole and in all directions at once. The growth changes according to 4 types. There is neural growth, the lymphoid growth, the general skeletal or visceral growth, and the genital growth. We know that the nervous system grows very rapidly before birth and also during the first 3 to 4 years of the birth. 80% of the nervous growth occurs before the child is about 4 years of age. Also, we see the brain also start growing, and which was originally about 1/8 of the body weight, it starts maturing by 10 years, it's about 1 by 18th of the body weight, and by 1 by 40th of the body weight by the time the child reaches maturity. The lymphoid tissue is the one which actually helps in the defense mechanism of the body, and it also starts growing. The skeletal system includes the bones of the body and it supports and it gives a particular structure, and the growth of the skeletal system is very rapid at birth. As also we see that the development of viscera such as respiratory and vascular organs also happen at the same rate as that of the bones and muscles in the body. The genital growth is seen after pubescence. So we see change in body height, weight, and body proportions, and also the physiological functions like sleep, eating, and elimination of waste. And we see that the child is able to distinguish between day and night, and the sleep time actually increases with age. We find that there are stages of social development and also which accompany the personality development occurring along with that of the physical development. We see that the middle to late childhood, that is from 6 to 12 years, that their friendship becomes more, and also we see that the pro-social behavior is actually complemented by later stages of the social development. The personality development is also gradually seen. We see about the Erik Erikson psychosocial development, where he talks about the personality development, where there is trust versus mistrust, shame versus doubt, and initiative versus guilt, and industry versus inferiority. All these start actually manifesting at this stage. And we also see that there is emotional and moral development in the child, where it occurs gradually. we find that the moral dilemmas are seen, judgments are seen, dissatisfaction levels are seen, justifying levels are seen. And we'll talk about the different stages of the childhood, which actually are resulting in all these changes and how these will lead to the adolescent growth stage. And this way I conclude here.